Okay, so good morning. Today we are going to learn about emergencies resulting from substance intoxication. So this is basically a emergency psychiatry lecture series. So we'll be telling you how to manage the cases or what you can do from an emergency point of view or in the emergency. Okay, so I'm Dr. Swaleha Mujawar, assistant professor, and I'll be teaching you about what emergencies can happen. So see, substance intoxication emergencies. So we'll just look at a comprehensive way in which substance intoxication emergencies can present. So see, they are very common occurrence in the healthcare settings, and they do pose a significant challenge for clinicians. Whenever a patient comes in intoxication, it is a challenge. These emergencies involve individual experiencing impaired functioning and safety risk due to the effects of various substances. So this presentation will provide a comprehensive overview of substance intoxication emergencies. So we'll be covering key aspects such as the common settings, clinical presentations, and some management strategies. So, one way in which a patient can present to you is substance-induced psychosis. So, this is quite a serious condition. So, what are the substances which can cause psychosis or can trigger psychosis? So, one is cannabis. The most common in which the patients present to us mostly is cannabis. So, it can trigger paranoia, hallucinations, and altered perceptions. So this is how patients can present. Less commonly we see other substances also, like if a patient has taken amphetamine, so patient will come with hyperactivity, agitation, again psychosis with paranoia and delusions. Cocaine we see less commonly in our settings, but again patient can have paranoia, hallucinations, violent behavior, hallucinogens like PCP. So again, very uncommon here, but after taking PCP, patients do have vivid hallucinations and altered sensory perceptions. Synthetic cannabinoids are also becoming very common, so in the form of gummies or different types of sweets, and in this area like bhang and everything is also quite common. So that can also mostly cause severe anxiety and agitation, but proper psychotic hallucinations can also occur. Alcohol less commonly causes psychosis, but especially if a patient has heavy or prolonged drinking, or patient is in delirium tremens, which is the withdrawal part of alcohol, that can also cause psychosis. And sometimes some prescription drugs. So patient can misuse some drugs which mostly contains stimulants. So sometimes we give stimulants for ADHD or depression, or people give opioids for pain or cough. So all these things patient starts taking and then starts misusing. So that can also trigger psychosis. So what are the symptoms? So delusions. Delusions, by definition, they are false beliefs that are not based in reality. So, delusions of persecution, delusions of reference, that people are trying to kill me or people are trying to plot behind my back, talking behind my back. This is what delusions are. What are hallucinations? They are sensory experiences that are not real. So patient might be seeing things, hearing things which are not there. तो पेशेंट माइट प्रेजेंट टू यू कि आवाजें सुनाई देती है, कोई मुझसे बात कर रहा है, या दिल से कि वहां पे कोई खड़ा है या कोई एनिमल है या कोई स्नेक है जो मुझे मार रहा है वगैरह. So this is what hallucinations are. Sometimes they might just have disorganized thinking. So difficulty with coherent thought process and communication. So this presents with irrelevant talk. So the relatives might just say कि अजीब अजीब बातें कर रहा है या क्या बोल रहा है हमें समझ में नहीं आ रहा है. So this is disorganized thinking, which is also part of psychosis. Agitation. So restlessness, anxiety, hyperactivity. Paranoia, we all know what that is: suspiciousness, fear, mistrust of others, or just plain violent behavior. So, violence behavior can be due to paranoia, secondary to paranoia, or patient might just be violent without any reason also. Now, delirium. So, delirium also you do see a lot in emergency setting or post-op setting. Delirium is very, very common. So, what are the symptoms? Symptoms में सबसे important to remember is there is fluctuating level of consciousness. So patient is either drowsy or patient is becoming unconscious, going in and out of consciousness. This is like the number one characteristic of delirium. Second is confusion. So again, patient might be confused where they are. Disorientation. So disorientation to time, place, and person. So patient might feel that they are at work or they are at home. Some patients say कि हम मंदिर में हैं. फिर day night disorientation होता है. They are not recognizing the family members. But all this should be fluctuating. So patient बीच बीच में normal भी हो रहा है, बीच बीच में delirium में भी जा रहा है. Individuals with delirium may experience again agitation, restlessness, या फिर slowed movements and lethargy. So hyperactive delirium, hypoactive delirium, that you have to decide. But both these things are delirium again. Other common symptoms are difficulty focusing attention, memory problem, or difficulty with language and communication. Delirium can also manifest as hallucinations, delusions, sleep-wake cycle disturbances. So you'll notice that there are a lot of symptoms which are overlapping. So in psychosis, in delirium, you will see symptoms overlapping. But main point to remember here is fluctuating level of consciousness and disorientation. That is going to differentiate it from other forms of psychosis. Then agitation and aggression. So recognizing agitation aggression is very important, because before the patient can get violent or can do some harm to some persons or some property, it is better that you identify, better that you treat as soon as possible. So agitation and aggression are different. For you guys, maybe they might be the same, but from psychiatry point of view, they are different. So what is the difference? Agitation is characterized by restlessness, that is the inability to sit still, and a heightened state of arousal. So patient is very, very alert, very, very aroused. A small stimulus will also lead to a lot of response from that patient. Individuals experiencing agitation may exhibit pacing, fidgeting, and rapid speech. So there is increased activity. Patient एक जगह बैठ नहीं रहा है, इधर उधर घूम रहा है, बहुत ज़्यादा बातें कर रहा है. They may also become easily startled or react impulsively. लाइक आई टोल्ड यू, एक छोटा सा भी स्टिमुलस देंगे, छोटा सा भी आवाज आएगा तो दिल भी लाइक कि क्या हो रहा है, और एकदम से जाके नहीं तो देखेंगे कि कहाँ पे क्या हो रहा है. दे आर नॉट सिटिंग एट वन प्लेस. एग्रेशन involves behavior that are intended to harm or threaten others. So aggression may definitely there will be some harm, physical or verbal harm, or some threat to the other. तो agitation mostly anxiety के towards जाता है, but aggression is again more towards psychosis, because there is some harm again. It can manifest as verbal threats, physical violence, or destructive actions. Individuals exhibiting aggression may display anger, hostility, and a lack of impulsive control. कि सडनली कुछ कुछ चीजें करने लग गए, इम्पल्सिवली कुछ एक्शंस कर रहे हैं, किसी को मार रहे हैं या प्रॉपर्टी डिस्ट्रॉय कर रहे हैं. तो दिस इज एग्रेशन. सो एग्रेशन इज डिफरेंट फ्रॉम एजिटेशन. Okay. Now, sometimes patient may present with severe anxiety or panic attacks. सो अगेन इफ यू लुक इट ऊपर ऊपर से तो सारा कुछ सेम ही दिखेगा. साइकोसिस विल ऑल्सो लुक very similar to anxiety or panic attacks. So you have to differentiate it. So again, anxiety or panic attacks can also be substance induced. So what are the substances that can cause anxiety? One is stimulants. So stimulants again like amphetamine or cocaine, they can induce anxiety, panic attacks, or a heightened state of arousal. Hallucinogens like LSD, psilocybin. Psilocybin are the mushrooms, basically. They can also trigger anxiety, panic attacks, and intense psychological distress. Cannabis, particularly high potency strains, can cause anxiety, panic attacks, and paranoia in some individuals. Alcohol withdrawal. Alcohol, because per se, is a CNS depressant. But when the patient goes into withdrawal, patient can have severe anxiety, panic attack. Tremors are like the more commonly seen, and very early stages of withdrawal में tremors दिखने लगेंगे and very early stages में anxiety भी दिखने लगेगा. So that means that you need to treat the patient. अब ये हो गया इंटॉक्सिकेशन स्टेज में. अब विड्रॉल सिंड्रोम्स कैसे प्रेजेंट कर सकते हैं? तो पेशेंट कैन स्टे प्रेजेंट टू यू इन अर्ली स्टेज, in middle stage, and in late stage. Okay, so in early stage, withdrawal is characterized by like tremors, I've told you. Patient can have sweating, anxiety, insomnia. So these are all symptoms of withdrawal. These symptoms typically appear within a few hours to few days after the last use of substance. So the most important question that you need to ask is ki when did you take the substance? If the patient has immediately taken the substance, then the patient is in intoxication. If a few hours have passed by, then the patient is in withdrawal. So you need to know the exact time कि कल रात को लिया था, पर कल रात को कितने बजे लिया था. 9 o'clock लिया था, 12 बजे लिया था, उससे भी बहुत डिपेंड करता है कि वो कौन से स्टेज में है. तो यू नीड टू आस्क ऑल दीज क्वेश्चंस. ओके, मिडिल स्टेज में क्या हो रहा है? एज विड्रॉल प्रोग्रेसेस, इंडिविजुअल्स में experience more severe symptoms. So severe symptoms में आता है हमारे hallucinations, seizures, and delirium tremens, which is specific to alcohol. These symptoms can be life-threatening and require immediate medical attention. So वही है कि psychiatrist को you are calling, but immediately if you can do something, give a sedative or give some treatment, so that is also better. In late stage, there is a gradual decrease in intensity because body थोड़ा बहुत recover करने लगता है, body adjust करने लगता है. So in late stage, again the symptoms are decreasing. However, individuals may continue to experience craving and some residual effects. तो ये late stage आता है हमारे weeks or months में. तो here तो maybe the patient might not even present to the emergency, but early and middle stage में तो emergency में present करता है, and you need to treat them also. Like for example, nicotine withdrawal symptoms. So nicotine withdrawal में starting में आएगा decreased sleep, anxiety, craving. लेटर स्टेजेस में यू सी वेट गेन, यू सी कफिंग, ये सारी चीजें होती है. तो यू नीड टू एक्चुअली डिसाइड कि व्हाट स्टेज द पेशेंट इज इन, because that will decide the management strategies. Now another very important emergency is suicide, because in psychiatry there are only two emergencies: suicide and homicide. And by homicide I mean the violent behavior. So suicide also should be taken very seriously. Suicidal ideation and self-harm requires immediate attention, because the patient we can lose the patient's life because of this. So immediate psychiatric evaluation is required. A thorough psychiatric evaluation is essential to assess the severity of suicidal ideation and self-harm. This evaluation helps determine the underlying cause and guides the development of a treatment plan. So, why the suicidal ideations are happening, what is the underlying cause, and that is important. And then treatment and support. So, individuals experiencing suicidal ideation or self harm need immediate treatment and support. This may involve hospitalization, close observation by family or friends, or if they are not ready to get hospitalized, at least participation in a structured support programs. So a lot of community support programs are also available. Medications such as antidepressants or mood stabilizers may be prescribed. So वो है अगर patient admit नहीं हो रहा है तो at least we can prescribe some antidepressants, some mood stabilizer. But if a patient has suicidal ideations, you need to get a psychiatric evaluation, and immediately a psychiatrist needs to see the patient. Now, another very important way in which a patient might present to you is serotonin syndrome, and this is something जो एकदम से दिमाग में नहीं आता है, या एटलीस्ट तुम लोगों के दिमाग में नहीं आता है कि if a patient is coming to you that it might be serotonin syndrome. So you need to know what are the symptoms. One is hyperthermia. ये I don't know if you're able to see this because थोड़ा सा ये है. So hyperthermia. So serotonin syndrome can cause dangerously high body temperature. This is because the excess serotonin in the body disrupts the body's temperature regulation system. So that is why the first and foremost presentation of serotonin syndrome is hyperthermia. Second is agitation. So people experiencing serotonin syndrome, they may feel restless, anxious, agitated. This is due to the overstimulation of the nervous system by the excess serotonin. ठीक है, तो पेशेंट अगर फीवर के साथ आ रहा है और एजिटेशन के साथ आ रहा है, तो देन यू शुड थिंक one of the differential diagnosis can be serotonin syndrome also. Patient can have tremors also. So involuntary muscle shaking or tremors are a common symptom of serotonin syndrome. This occurs again because of excess serotonin affecting the muscle's ability to function properly. And this can also be one of the reasons for fever also, because बहुत ज़्यादा muscle contraction हो रहा है, that is leading to increase in temperature. Sometimes seizures can also occur. तो अगर बहुत ज़्यादा उसने serotonin वाले drugs खा लिए, तो in severe cases serotonin syndrome can cause seizures. These are caused by uncontrolled electrical activity in the brain, often triggered by the overstimulation caused by excess serotonin. And then autonomic instability भी होती है. तो excess serotonin can disrupt the body's autonomic nervous system, leading to rapid heart rate, excessive sweating, fluctuations in the blood pressure. So all these are symptoms of serotonin syndrome also. So asking history is very important, that what drug the patient is taking. The patient is on some drugs which can increase serotonin and has all these symptoms, then serotonin syndrome can be one of the causes. Now coming to management. So key management principles, a systematic approach is very important. So immediate assessment and action, what can be done? One is prioritize the patient's safety and stability by assessing the condition. So this includes vital signs, which you guys always take, mental state examination, which usually the psychiatrist assesses, and also seeing if there are immediate threats. So threats to other or threats to the patient himself, followed by appropriate interventions to mitigate them. So informed medication use medication judiciously by symptoms, considering the specific substance involved. So substance to substance the medication changes, and the patient's clinical presentation. This ensures safety and minimizing the potential side effects. Also addressing the underlying cause, so identifying the underlying cause. So is it intoxication, is it withdrawal, treating the substance use disorders, managing the withdrawal symptoms, and if some coexisting medical conditions are there, then that also needs to be treated. Okay, so this is from your point of view at least. Other specific treatments, of course, the psychiatrists are going to handle, but till the psychiatrist comes, at least these are the things, assessment and treatment from your point of view. Okay, so with this, we finish the substance intoxication point of view. Any doubts, any questions?